Did you know that certain common medications taken by millions of seniors may be linked to memory concerns? Before you panic, let me be clear. I'm not telling you to stop anything. I'm showing you what research suggests about medication side effects so you can have informed conversations with your doctor. Some widely prescribed drugs have been studied for their potential cognitive effects, and understanding this connection empowers you to advocate for yourself. Today I'm walking you through 9 medications that research has linked to memory changes, ranked from commonly overlooked to most significant. And number 3 might surprise you because it's prescribed for something that seems completely harmless. This isn't about fear. This is about knowledge. Before we continue, drop a comment below. What medications are you currently taking? And have you noticed any brain fog or forgetfulness after starting a new prescription? Sharing your experience helps others know they're not alone. Now, an important disclaimer. Never stop any medication without talking to your doctor first. Stopping certain drugs suddenly can be dangerous or even life-threatening. This video is educational information, not medical advice. Always work with your healthcare team. Let's start at number 9. And don't let its position fool you. This medication sits in almost every medicine cabinet. Number 9. Diphenhydramine Benadryl. Diphenhydramine is that familiar pink pill trusted for sleep, allergies, and cold symptoms. It's over-the-counter, inexpensive, and seemingly harmless. But research suggests it may affect memory, especially with long-term use in older adults. Diphenhydramine belongs to a class called anticholinergics, which work by blocking acetylcholine, a brain chemical important for memory and alertness. A 2015 study in JAMA Internal Medicine found that older adults using anticholinergic medications regularly had higher rates of cognitive decline over time. Here's what to consider. If you're using diphenhydramine regularly for allergies, newer non-sedating options like loratadine, sold as Claritin, don't cross the blood-brain barrier as easily and may be safer for long-term use. For sleep, talk to your doctor about alternatives. Melatonin, sleep hygiene improvements, or addressing underlying sleep disorders might be better options. Key point: over-the-counter doesn't mean risk-free, especially for brain health. Number 8. Proton pump inhibitors, Prilosec, Nexium. These medications, called PPIs, reduce stomach acid and are prescribed for heartburn and acid reflux. Many seniors take them for years because symptoms return when they stop. Research has raised questions about long-term PPI use and cognitive function. A 2016 study in JAMA Neurology examined over 73,000 older adults and found that regular PPI users had higher rates of dementia. The mechanism isn't fully understood, but PPIs may interfere with vitamin B12 absorption, which is crucial for brain health. What to discuss with your doctor? Can you taper off with help from H2 blockers like famotidine, sold as Pepcid? Are there lifestyle changes like eating smaller meals, avoiding trigger foods, or elevating your head while sleeping that might reduce your need for medication? The goal isn't to suffer with reflux. It's to use the lowest effective dose for the shortest necessary time. Number 7. Bladder control medications, oxybutynin. Oxybutynin, sold as Ditropan, is prescribed for overactive bladder. It works by blocking acetylcholine, the same memory chemical affected by Benadryl. And unlike some medications, oxybutynin crosses the blood-brain barrier easily. Research published in the British Medical Journal found that seniors taking strong anticholinergic medications like oxybutynin for more than a year had higher dementia risk. The cognitive effects are often mistaken for normal aging, forgetting appointments, misplacing items, struggling with conversations. If you're taking oxybutynin and notice mental changes, ask your doctor about newer medications like mirabegron, sold as Myrbetriq. It works through a different mechanism and doesn't block acetylcholine. Bladder control is important, but there are often safer alternatives. Number 6. Statins, simvastatin and atorvastatin. Statins like simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed drugs worldwide for lowering cholesterol and reducing heart attack and stroke risk. The relationship between statins and memory is complex. Some patients report memory issues, but large studies show mixed results. Some research suggests certain statins may have protective effects against vascular dementia. However, individual responses vary. If you're on a statin and experiencing memory concerns, don't stop. Instead, discuss with your doctor whether a different statin might work better. Pravastatin and rosuvastatin don't cross the blood-brain barrier as easily. Sometimes a dose adjustment or switching medications resolves the issue while still protecting your heart. Heart disease kills. Work with your doctor to balance cardiovascular protection with cognitive concerns. Number 5. Benzodiazepines, lorazepam, diazepam, alprazolam. Benzodiazepines include lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax. They're prescribed for anxiety and sleep problems and work by enhancing GABA, your brain's calming chemical. Research has raised concerns about long-term use. A study in the British Medical Journal found that seniors using benzodiazepines for extended periods had higher rates of cognitive decline. The risk increased with longer-acting benzos like diazepam. Here's the challenge. These drugs can be difficult to stop. Withdrawal symptoms like severe anxiety and insomnia can be brutal, making the drug feel essential when it may be contributing to the problem. If you've been taking a benzodiazepine for more than a few weeks, work closely with your doctor to taper gradually over weeks or months. Safer alternatives like buspirone for anxiety or cognitive behavioral therapy for insomnia may help without the same cognitive risks. Never stop suddenly. This can be dangerous. Number 4. Amitriptyline, Elavil. Amitriptyline, sold as Elavil, is an older antidepressant still prescribed for chronic pain, insomnia, and migraine prevention. It's one of the most potent anticholinergic medications still in use, meaning it strongly blocks acetylcholine. A 2015 JAMA Internal Medicine study found that older adults taking high cumulative doses of anticholinergic medications like amitriptyline over 10 years had significantly higher dementia rates. The American Geriatric Society's Beers criteria list includes amitriptyline as potentially inappropriate for older adults due to cognitive risks. Discuss alternatives with your doctor. For nerve pain, duloxetine or gabapentin might offer relief without the same anticholinergic burden. For sleep, low-dose doxepin has a milder profile. For mood, newer antidepressants like sertraline or escitalopram are generally safer for long-term brain health. Number 3. Paroxetine, Paxil. Paroxetine, sold as Paxil, is an SSRI antidepressant prescribed for depression and anxiety. Here's what makes it different. It's the only SSRI with significant anticholinergic properties, meaning it interferes with acetylcholine. Research in Frontiers in Psychiatry found that elderly paroxetine users showed measurable declines in short-term memory and attention within 12 months compared to those taking other SSRIs. The American Geriatric Society lists paroxetine on its Beers criteria as potentially inappropriate for older adults. If you're taking it, ask about switching to safer alternatives like sertraline or escitalopram, which don't carry the same cognitive concerns. Mood stability is crucial, but there are better options available. Number 2. Antipsychotics, quetiapine, risperidone, olanzapine. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were developed for serious psychiatric conditions, but they're sometimes prescribed off-label to elderly patients for sleep problems or mild agitation. Research in The Lancet found that seniors prescribed antipsychotics for behavioral symptoms had higher rates of cognitive decline within 12 months. These medications also increase stroke risk and sedation, which can lead to falls. If you or a loved one is taking an antipsychotic, ask why it was prescribed and whether it's truly necessary. In many cases, behavioral symptoms can be managed with non-drug approaches like structured routines, addressing pain or discomfort, and improving sleep hygiene. When medication is necessary, use the lowest dose for the shortest time. Number 1. Anticholinergic polypharmacy. The most dangerous situation isn't one specific drug. It's taking multiple medications with anticholinergic properties at the same time. This is called anticholinergic polypharmacy. Imagine taking diphenhydramine for sleep, oxybutynin for bladder control, and amitriptyline for pain. Each alone might cause mild memory issues, but together they compound exponentially. Research in Age and Aging found that older adults with the highest anticholinergic burden had significantly higher dementia risk over 10 years. The solution is a comprehensive medication review. Ask your doctor or pharmacist to evaluate your complete medication list for anticholinergic load. There are tools that calculate your cumulative burden. Once identified, you can work to deprescribe safely, switch to alternatives, and rebalance your regimen. Here's the empowering part. Drug-induced cognitive changes are often reversible when caught early. When the medication burden is lifted, many seniors regain mental clarity within weeks or months. So here's what to do. Schedule a medication review with your doctor. Ask specifically about anticholinergic burden. Discuss whether each medication is still necessary. Explore safer alternatives when available. And never stop anything without medical guidance. I want to hear from you. Which medications are you taking? Have you noticed cognitive changes? Will you schedule a medication review? Share in the comments. If this helped you, like and subscribe for more evidence-based health content. Share with someone who needs this information. Knowledge is power, but only when combined with proper medical care. Take care, and remember, informed patients get better outcomes.